Did you have a good New Year's and stay out of trouble, young man?
I did, yes. How about yourself?
Yeah, of course. Always, married 30 years. It's nice just to relax with my honey and have a great New Year's Eve. And now that you're married, you're going to see all those things down the road. You'll get to enjoy all those moments as well. Um, Advantage Athletic Therapy on the Queensway. We're talking to my friend Braden from there. I want to ask a couple questions about diagnosis today.
Okay.
Years ago, I came to you guys and Paige. I had a shoulder problem, and I remember Paige like it's the problem. What it really was in my back, in my upper quadrant, and she had to convince me. Like I was like, it's my shoulder, right? I wanted you to explain that to folks. Like you guys, your schooling, your background. I don't know how many years you guys go, but that's what you study, right? This is what you do.
Yeah, for sure. I think we get told pretty early on in our schooling that we never want to chase pain. And what our professors meant by that was there's going to be times where people come in and it's like, yeah, you sprained your ankle. Obviously, like we can see what the problem is, which is great. We can address that. And then we want to think about, okay, well, maybe why did this happen? Even for something as simple as that, it's like, well, maybe you were a little bit weak in your perineals and then you're more prone to have an inversion ankle sprain. So then it's like, oh, well, maybe we'll strengthen that area to help with that. Other times people might come in with pain and say their knee. And it's like that's the spot where it hurts. Like they can point with their finger and then looking at their biomechanics or maybe at their gait, I can say, well, maybe I think it's this. And then doing a couple special tests, it's like, yeah, this is where it's stemming from. It's actually up from your hip or tight hip flexors, which is causing pain into the knee. And I think sometimes it takes a little bit of a buy-in from a patient perspective because like I can understand how they would feel. They come in, well, it's like my knee hurts. Why are you worrying about what's going on in my hip? But it's that whole kinetic chain and like ground reaction forces that go from one segment to the other that we really have to kind of appreciate, understand, and treat as like a whole perspective.
And it's just the balance of it all too, right? Because if you don't take care of your body, that's multiples, right? You're going to get other areas that are going to start. If you've got this knee problem and you don't get it addressed, you think it's a knee problem, turns into a hip problem, turns into a bigger problem. And I think that's part of the as you age, you kind of like, I'm okay, but it isn't because it just keeps building out from there, doesn't it?
Well, definitely. And the one great thing about us is we're very adaptable and we can do that for long periods of time, but eventually we can't compensate any longer. So like you said, that knee problem to hip, yeah, maybe you're compensating and moving more on the right side versus the left side, start to get tight over here, and then pain starts to develop. And then now we have a whole list of issues. And as you said, as we get older, we can't maybe do it as efficiently. That little ache or pain that we used to have when we were younger and it went away after a couple of days, now it starts to linger and then it starts to manifest and then we start to feel it in other parts of our bodies. That's why it's important to try to address the correct issue.
Is the knee the most common for that to see that other link, or is there other body parts that you guys go, oh, if you're looking at a bad shoulder, like is there common ground that way that you guys see a lot in certain
Definitely,
injuries?
yeah. Shoulder and neck is a big one. There's a lot of muscles that attach out near our shoulder that come up to our neck, or maybe we even have something called referral pain, where you have like an injury or a tight muscle somewhere, and that's going to refer pain to another part of the body, which makes us it's confusing. It doesn't make
Yeah.
sense to somebody who isn't aware of what's going on. It's like, well, I feel this pain. Usually, it's like a lot of like lateral shoulder pain. It's like, well, my deltoid, like that must be what's injured, but it's oftentimes it's something else. It could be upper fiber traps. It could be your supraspinatus. It could be a whole list of things, but it's not always as easy as, well, it hurts here. That's what's wrong.
Uh, just to clarify for people, because I don't think they understand the schooling and the work terms you guys have to do to get to this level. Like it's not easy, is it? If somebody wants to start out in this field, it's some work, isn't it?
Well, it is, and I think that's a good part of the program is that there's so much hands-on learning. Like from second to fourth year, we're always doing placements, so it was usually class until 2 or 3 p.m. and then placement from 3 to usually 10 or 9, and they're long days, but that's more opportunity to see things, understand things, because I think if you read it in a book, it makes sense, but until you're actually seeing it and dealing with it, you don't really have that hands-on experience to translate into the clinic life.
And plus, you're like you said, that experience. I mean, I imagine the first time you saw somebody with in your schooling with the knee issue, you're probably running through your checklist in your brain already to try and understand what that person's going through, right?
Yeah, and like the very first time, it was definitely like, well, it's a knee injury, so let's figure out what's wrong with the knee. And then it's the more experience you have, and you can kind of take that step back and think, okay, well, maybe it is coming from somewhere else. Then you start to investigate that, and yeah, it just takes time and repetition and practice.
How many years you been doing it now?
This will be my third year, third full year at Advantage.
So you've already put in 7 years doing this, eh?
Yes.
I mean, that's right there. There's your 10,000 hours, folks. The guy knows what he's doing. Anything else you got to add today? Can they book online? How do people get a hold of you?
Yeah, you can book online, and we'll actually, by the time this comes out, we'll be at our new clinic on Cedar Street.
Oh,
So we
wow.
are moving from the Queensway. Yeah, I know, news to you, breaking it right now.
It's
And
breaking.
all our patients will have an email sent out giving them the location. But yeah, we're moving into the old medical office there on Cedar Street, and yeah, kind of a little bit of collaboration. So we're really looking forward to that, and I'm sure things have been going smoothly.
Excellent. Thanks for taking the time today, and I'll look for you on Cedar Street. Thanks for
All
doing
right,
this. I appreciate it.
sounds good.